2010, Obamacare, which is still the law of the land. Make no mistake about that, ladies and gentlemen. It is still the law of the land. Centralized computer records. Government-controlled health care give the governments everyone's medical records. Everyone's. Your medical records will not be private. It is still the law of the land. Anytime anyone's situation changes, a raise, a new job, a move to another state, that person will be required to report it to the IRS. 2010, Obamacare, which is still the law of the land. Good evening, ladies and gentlemen. The purpose of the presentation you are about to see is to update you on what is going on in medical care in the United States today. The presentation will discuss where we are, how we got there, where we're going, and some solutions. To give you a little bit of my background, I have been studying medicine since 2010 when Obamacare was passed. I have talked to hospital administrators, Medicare administrators, Medicaid administrators, doctors in teaching hospitals. I've gone to medical conventions and I've talked to doctors and nurses from both the United States and Canada. This is about the 13th revision to this presentation because I like to keep it update and current. And before I give the presentation, I run it past medical professionals to make sure that I'm giving you as accurate information as possible. So, ladies and gentlemen, medical realities. Everyone must get health care. You hear that all the time. You don't always hear the second part, which is someone must pay for it. A large number of Americans love clinical medicine. Presbyterian Health Plan, Loveless Health Plan, Kaiser Health Plan. These are all HMOs, and that's fine. If that's what you like, if that is your choice and you're willing to pay for it, that's fine. Too many Americans equate health insurance with actual health care. Health insurance is not health care. Health insurance may or may not pay for the health care your doctor recommends. Too many Americans are not aware of how the medical community is reacting to Obamacare and its aftermath. There are not enough medical professionals. The situation is getting worse, not better. Doctor after doctor that I have talked to have told me they have discouraged their children from going into medicine because it is no longer a viable career path. The only real question is, how do we deal with these realities? I could be a politician and tell you what you want to hear all the time, kicking the can down the road. But ladies and gentlemen, we have reached a crossroads. We have reached a fork in the road. And medical in this country is going to go one way or the other. Either socialize medicine or eliminate third-party payers. One way or the other. There really is no middle path. Where are we now? One step away from socialized medicine. No way, can't happen here. I hear this all the time. Well, here's one of Donald Trump's famous tweets. The Democrats are pushing for universal health care, while thousands of people are marching in the UK because their universal system is going broke and not working. Dems want to greatly raise taxes for a really bad and non-personal medical care. No thanks. On this particular tweet, I agree with President Trump. To offer Americans an alternative to single-payer health care, Republicans must act this year. Republicans must act. Congressional Democrats, the president notes, are pushing their universal health care agenda. The lead vehicle is Vermont Senator Bernie Sanders' single-payer plan, Senate Bill 1804, billed as Medicare for All, which has attracted 16 Senate Democrats as co-sponsors. That is 32.7% of the Democrats in the Senate, and they include both senators from New Mexico. The bill would create a government monopoly over health care. It would outlaw all private health insurance, including Americans' job-based coverage. Impose restrictions on private medical practice, which means no personal freedom, no personal choice. Ironically or incredibly, more than half of all House Democrats are backing a similar bill, H.R. 676. That is, more than 92 House Democrats want to completely control your health care. How did we get here? In 1966, we had Medicare. But Medicare is growing broke because it is and always has been a Ponzi scheme. In 1966, life expectancy was 70.3 years, and that's an average between men and women. Population over 65, 18.8 million. 2016, life expectancy is 78.8 years. Population over 65, 46.2 million as of 2014, which were the latest figures I could get. Life expectancy has increased by 12%. Population over 65 increased by over 240%. Ponzi scheme. People that got in first got the money. 1982, Medicaid. 1997, Children's Health Insurance Program, just extended for 10 years. 2010, Obamacare, which is still the law of the land. Make no mistake about that, ladies and gentlemen. It is still the law of the land. Let's take a moment to discuss Obamacare. Now, normally when we discuss something, the first thing we do is define it. This is Obamacare, Public Law 111148. It is filled front to back with pages printed on both sides with number 10 font. And as you can see, it takes two hands to hold this up. How do you define this? To give you a comparison, these are our founding documents: the Declaration of Independence and the Constitution of the United States. And as you can see, I can hold these up with two fingers. The Declaration of Independence defines human rights. We hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights. Among these are life, liberty, and the pursuit of happiness. That defines America. Constitution gives us a roadmap to guarantee those rights. We the people, with emphasis on we the people. Did we the people, through our elected representatives, write Obamacare? Who actually wrote the health care law? Section after section of Public Law 111148 contains the wording, "The Secretary shall." This phrase appears 1,444 times. So you would think that Kathleen Sebelius, being the confirmed head of HSS, would have a lot to do with writing the law. Well, now we know that Mr. Gruber, who thinks Americans are too stupid for the truth, actually wrote the law. Question: did you see his name on a ballot any place? Did you see him in front of the Senate being confirmed by the Senate? He reported to one man and one man only, Barack Obama, and he wrote the health care law. The Department of Health and Human Services submitted a final rulemaking on the state of health insurance exchanges that created yet another accounting shell game, one that could force private citizens to pay for coverage of elective abortions. Wait a minute, time out, time out. We have a U.S. Constitution, and Amendment 1 clearly states Congress shall make no law respecting an establishment of religion or prohibiting the free exercise thereof. Ladies and gentlemen, there are many, many people in this country who hold strong religious views against abortion. And they feel by being forced to pay for abortion with their tax dollars, they are being prohibited from the free exercise thereof. To compel a man to furnish funds for the propagation of ideas he disbelieves or abhors is sinful and tyrannical. Thomas Jefferson. Centralized computer records. Government-controlled health care give the governments everyone's medical records. Everyone's. Your medical records will not be private. The language is not in the law. It is in the Federal Register, which has the force of law. The authority comes from HIPAA, which allows release of patient records without consent to other agencies for other activities necessary for the oversight of the healthcare system. And the irony in this, ladies and gentlemen, is we were told that HIPAA would guard our medical records and keep them private. Healthcare, as dictated by the government, also directs the IRS to share confidential and personal tax returns with the exchanges and other government agencies. You have no reasonable expectation of privacy regarding any communication of any data transmitted or stored on this internet system. Ladies and gentlemen, that is on the official website for the medical exchanges. But you won't find that on the home page. You have to go to the source code to find it. But it's there. Question: is there a chain of accountability? If so, who's accountable? Internal Revenue Service? Well, we all know how the Internal Revenue Service holds people accountable for their actions. It is the IRS who will make sure all taxes are paid and will also determine who is eligible for taxpayer-financed subsidies. Anytime anyone's situation changes, a raise, a new job, a move to another state, that person will be required to report it to the IRS for purposes of recalculating their eligibility. Ladies and gentlemen, there are two things that most Americans consider their own private business, and that is the state of their physical health and the state of their financial health. Yet, both of these records will be mixed in a database in Washington, D.C. for any government clerk to look at any time they want to for other activities. Thinking about it, ladies and gentlemen, you get a raise and you have to report it to somebody like her before you even tell your significant other. George Orwell's 1984 has fiction become reality? But no one has put this better than Ben Stein. Fathom the hypocrisy of a government that requires every citizen to prove they are insured, but not everyone must prove they are a citizen. And now any of those who refuse or are unable to prove they are citizens will receive free insurance paid for by those who are forced to buy insurance because they are citizens. And ladies and gentlemen, this is just as true today. Even with the minor changes that have been made to Obamacare, that's a very true statement. Question: how did this happen? The law was passed by one political party. Not one Republican voted for it, not even Olympia Snowe. Those who voted for it did not read it. They passed it on sound bites. There was open bribery of elected officials. We all know about the Louisiana Purchase. Think about it. Our elected officials were bribing other elected officials with taxpayer dollars on television. Can you imagine what went on behind closed doors? Promises made. If you like your coverage, you can keep your coverage, period. If you like your doctor, you can keep your doctor, period. Unfortunate truth. President Obama lied, period. Since we are so close to socialized medicine, let's take a look at what it might look like. This is the table of organization and chart for Obamacare. Can you imagine what it would look like when there's absolutely no competition? Who is in control? That is a question that should be keeping you awake at night. Section 6301 establishes a patient-centered outcomes research institute. Establishment. There is authorized to be established a nonprofit corporation to be known as the Patient-Centered Outcomes Research Institute, which is neither an agency nor establishment of the United States government. That, ladies and gentlemen, comes directly out of the law, word for word. And it is full of paragraphs just like this. Here it is, right here. 21 pages of print so fine you need a magnifying glass to read it. And paragraphs like this that say subpopulations, clinical effectiveness, medical treatments, so on and so forth. And remember, it is neither an agency or established of the United States government. Now, there used to be an independent payment advisory board, which no longer exists because even the Democrats couldn't defend that. And we hear a lot about that, but we don't hear anything at all about this agency. I wonder why. Quote from the official Democratic Party talking points on government-controlled health care. And I have them right here, ladies and gentlemen, and the cover letter is signed by Nancy Pelosi. Question. I have heard that under the health care law, there is a panel that can order my doctor not to give me certain procedures, therapy, or care. Bureaucrats will decide whether I live or die. Answer. There is no such panel. This is a blatant falsehood. Section 6301, Patient-Centered Outcomes Research Institute. Kind of a clunky name, and it lacks the panache of the English system, which is nice. National Institute for Health Clinical Excellence. But make no mistake, ladies and gentlemen, these two boards have the exact same job: to determine the quality-adjusted value of life. And anybody that doesn't believe me, all they have to do is look at the news and what happened to that young boy in the United Kingdom. Obamacare is like a cancer to American freedoms. It must be cut out before it metastasizes. Watch out for the public option, which is simply a backdoor to socialized medicine. Let's take a look at socialized medicine. This is kind of a comical look at it. You can tell where the doctor is holding the stethoscope. But there's an article by Dr. Jeffrey Singer. It's a one-page article, and it really sums up what socialized medicine is. I want to read you just the middle paragraph. In other words, we are about to experience the two-tiered system that already exists in most parts of the world that provide universal coverage. Those who have the financial means will still be able to get prompt, courteous, personalized, state-of-the-art health care from providers who consider themselves professionals. But the majority can expect long lines, mediocre and impersonal care from shift-working providers, subtle but definite rationing, and slowly deteriorating outcomes. That, ladies and gentlemen, is something I would never like to see happen in this country. But unfortunately, it has already started. In the last 4 years, there has been a 60% increase in physicians employed by hospitals. That is 165,000 physicians no longer in private practice. You can have the best insurance in the world, but you got to find a doctor. As reported by the Association of American Physicians and Surgeons, death, the only treatment option. Quebec Palliative Care Clinic to be killing center. Palliative care is what we call hospice. When a palliative care center in Quebec announced it would not offer euthanasia, the Minister of Health ominously told it, yes, you will. In the UK, patients are pushed to choose suicide over abandonment and unreasoned pain. What that simply means, ladies and gentlemen, is if you're at a certain age and you have terminal cancer and you go to the hospital, you have a choice. Take a pill and kill yourself, or go home and die in pain because they're not going to manage your disease or they're not going to manage your pain. Think about it, ladies and gentlemen. The two most parts of any society that have no protection and are very vulnerable are the very young and the very old. And what have we come to in this country? We've come to abortion on the very young and euthanasia on the very old. And if you really think this isn't happening, how many states have already authorized physician-assisted suicide? Single-payer IQ test. There's 8 questions on the test, and each one of the answers is backed up with 2 or 3 pages of documentation. And I'm not going to go through all of that today, but I want to give you the highlights. If anybody is interested, simply email me and I will email you a link. Question 1, who is the single payer? The federal government. Question 2, what if single payer does not authorize a service? The faceless single payer calculates the value of your life based on benefits to society. The single payer determines what treatments are necessary and appropriate for you. Can anyone say quality adjusted value of life? Question number 3, who will do the work? Younger and less experienced physicians, foreign physicians, subservient physicians, non-physicians, or possibly no one. Question 4, who gets paid and in what order? Some money will trickle down to those who help patients, but 40% or more may be siphoned off en route. The single payer pays administrators, rule makers, compliance officers, auditors, investigators, prosecutors, information technology vendors, etc. first. Medical professionals second. And most doctors will tell you that's rubber money, because they may pay you, but then if they don't like the way you coded the paperwork, they want it back. Question 5, how much will it cost? $32 trillion over 10 years is one guess. Actually, it will devour every dollar that has been taken from taxpayers or creditors and diverted to the system. Question 6, how would single payer control costs? The single payer would try to limit spending with wage and price controls and possibly a global budget. Global budget. Question 7, how would single payer now be implemented? In other words, how would they put this into effect immediately? Even Vermont hasn't been able to figure this out. Question number 8, does single payer guarantee a right to health care? Remember in the first slide we talk about everybody needs health care. But does single payer really guarantee the right to health care? If you have to obtain government permission to buy something with your own money, is it a privilege? Not a right. The supposed right to health care abolishes rights to life, liberty, and property. Solutions. Let's talk about some solutions. The American people taking personal responsibility for their own health care. Medicine that is free of government and insurance company intrusion and protects the sacred bond between doctor and patient. Eliminate third-party payers. Ladies and gentlemen, this is key. Get the government out of it. Get your company out of it. It's between you and your medical provider. Question: why is Costco and IKEA so popular? The business model is very simple. eliminating the overhead and profit of a third party. In other words, the manufacturer delivers directly to the stores, eliminating warehousing costs, distribution costs, and the profit that entails. Something to think about. Salaries for CEOs of 5 health insurance companies, just 5. Centene is the biggest, 22 million, and I don't know much about them except when you really research it, they do a lot of government work. But take these 5 and it adds up to $94.7 million. You and I, ladies and gentlemen, pay the salaries of the 5 CEOs to the tune of $94,700,000 a year. This does not count stock options, does not count benefits, does not count offices. It does not count the whole structure that is required to administrate this. And you and I pay every single penny. Question: when you put gas in your car, you fully expect to pay. When you have a meal in a restaurant, you fully expect to pay. When you go to Costco, you fully expect to pay. So why is it when you go to the doctor or hospital, you expect someone else to pay? Why is that? So what, if anything, should the government do? If at all possible, we need our government to adhere to the KISS principle. Keep it simple, stupid. Simply put, there's only 3 things I require. 3 things, ladies and gentlemen, that's it. I can write the law on 1 sheet of paper on just 1 side. Number 1, true health savings accounts. Money put into account for the payment of medical expenses and only medical expenses. No taxes at all, not even payroll taxes. Number 2, true catastrophic insurance. Insurance that covers only the major illnesses, cancer, heart attack, stroke. Number 3, all medical expenses taken off the top of your income. Now let's discuss that for just a minute. If you have a Roto-Rooter franchise and you tell one of your employees to go get the truck washed, the complete cost of getting that truck washed comes right off the top of your income. Why? Because it's the cost of doing business. Well, ladies and gentlemen, most of us do business with our minds and our bodies. This is all we have. If we're sick, we can't do business. We can't go to work. So any money that is spent to keep our minds and body in perfect shape should be completely deductible, come right off the top of our income, just like corporations. The key: the HSA and catastrophic insurance policy belong to the patient. If the patient changes jobs, the HSA and insurance policy goes with them. Therefore, pre-existing conditions are no longer an issue. Realities. How do we realistically end up with a workable solution? As a nation, the following question has to be answered. Is it the job of the federal government to ensure every American has health insurance? The state government? The county government? Government at any level? No solution is possible until that question is answered. If the answer is yes, be prepared to turn over your decisions on your health care to the same people that run Post Office, TSA, IRS, DMV. Because after all, ladies and gentlemen, a bureaucrat is a bureaucrat is a bureaucrat. If the answer is no, be prepared to take personal responsibility for your own health care. Catastrophic health insurance, health savings accounts, all medical expenses off the top of your income. In other words, freedom of choice. Free to choose your doctor, your health plan. The American people have voted away their freedoms in exchange for the promise of free medical. It only took 2 generations from what we commonly call the greatest generation. Ladies and gentlemen, this country has problems. many problems. But we have had problems in the past. This is George Washington taking the Continental Army into winter quarters. They had no shelter, they had no food, they had no medicine. But George Washington had a patriot known as Thomas Paine. Thomas Paine wrote many articles, but one of his most famous is commonly called the Sunshine Patriot. These are the times that try men's souls. Will you be a sunshine patriot and only fight in the warmth of summer? Or will you see the cause through in the cold and dampness of winter? Ladies and gentlemen, we can't afford any sunshine patriots. We all must demand from our elected officials that they repeal Obamacare in its entirety. Call them every day, email them every day, pound every elected official at every level. Because after all, ladies and gentlemen, if the government controls your health care, they control you. Individual control equals individual choice. Remember, ladies and gentlemen, there is a saying as old as time itself. He who pays the piper calls the tune. Now, I've asked you many questions today, ladies and gentlemen, but there are some things I'm absolutely sure of. These are founding documents, the Declaration of Independence and the Constitution of the United States, define and guarantee our freedoms. And Public Law 111148, Obamacare, does this to our freedoms. Thank you for your time. Patient-Centered Outcomes Research Institute. Question. I have heard that under the Health Care of All, there is a panel that can order my doctor not to give me certain procedures, therapy, or care. Bureaucrats will decide whether I live or die. The quality adjusted value of life. In the UK, patients are pushed to choose suicide over abandonment and unreasoned pain. What that simply means, ladies and gentlemen, is if you're at a certain age and you have terminal cancer and you go to the hospital, you have a choice. Take a pill and kill yourself, or go home and die in pain because they're not going to manage your disease or they're not going to manage your pain. Obamacare, it is still the law of the land.
But we have to pass the bill so that you can find out what is in it.
Sometimes government has to step in to help deliver on that promise.
If the government controls your health care, they control you.